symptomatic. We are now picking those up. The second reason we're seeing so many positives and so much variability in the testing day by day is that some of our labs, some of our private labs are reporting their tests in clumps. Because they are so busy, because there's so much more testing going on in our community and especially in our country, as we see this sweeping other parts of the country, our labs are overwhelmed, and sometimes it takes 3, 5, 7, and even 10 days to get results back on some occasions. So they're being reported in clumps. Some days we'll see 240, and then another day we'll see 80 or 150. That's why we're making our decisions on public health policy based on a rolling 7-day average and not a single day result. The third issue, the third reason why we're seeing so many positive tests is that there are so many more people out and about. And there is more movement in the community of COVID-19, especially in the 10 to 19 age group and the 20 to 29 age group. We're watching these numbers closely. We're obviously concerned about where the virus might be in our community and how it can continue to spread. We know that gatherings of young people and adults around youth sports are the primary source of spread in the community, youth and adult sports. We're looking at those guidelines now, and we're going to make a decision on whether or not youth and adult sports guidelines need to be adjusted. And we'll know more about that on Friday. In a conversation with the Pandemic Task Force yesterday, we talked about all of our guidelines and whether or not we would have to make any more adjustments in the current business guidelines that we have. And we're talking about that as well. We would like to not make any more adjustments. We would like to not have to roll back any of our restrictions, but the health and welfare of everyone in St. Louis County will always be our top priority. The competition between health and welfare and our economy does not have to be mutually exclusive, but it depends on everyone following our business guidelines and following them closely. We were one of the first jurisdictions in the country to issue stay-at-home orders, and our slow and cautious reopening has left us in a better position than many places in the country. Our Department of Public Health is looking at all of our guidelines, not just youth and adult sports, and again, considering whether or not we need to make any changes. All of our guidelines now require a 50% capacity, restaurants, retails, pharmacies, and others, and we are not currently considering at all expanding that capacity limit. We're currently reviewing all of our guidelines. We'd like to continue our steady reopening, but of course, nothing will ever be normal until we have a vaccine, and we must follow these guidelines very closely. Face coverings are required so we can continue with our current status of reopening without any rollbacks. We know that the vast majority of people in St. Louis County understand and appreciate the importance of face coverings and are complying with this. And I want to thank everyone who has been working so hard to get the word out on face coverings. We also know that not everyone in a community is applying our mask guidelines. Not everyone is listening. We do get some complaints from employees and patrons and customers of businesses, all with concerns that mask guidelines aren't being followed by employees and by some customers. Our priority is helping businesses stay in business. And often all they need is a reminder, a letter of what the rules are, and they will get the word out, and they will tell their employees, and they will tell their patrons and customers. We know that if customers go into a business and they feel that it's unsafe, they will not be back, and they will tell their friends. We understand that this is the best way to get compliance, along with reminding the businesses what the right thing to do. Again, the vast majority of people in St. Louis County want to be safe, want to know what the right thing is to do, and they want to do it. So here are some reminders about masks. You are not allowed to go into a business or public transportation without a face covering. If you work in an office or a job where you are in close contact with others, other employees or members of the public, then you need to have a face covering. You need to have a face covering when you're seated at an indoor restaurant or bar, when you're not eating. You need to have a face covering when you're up walking around or when you enter or exit the building. You need to have a mask on when you go into someone's house to provide a service, to do maintenance work, or do any sort of repair work. And you should have a mask on when you're outside if you're not able to socially distance from others. And here are some instances when face coverings are not required. When you're at home, when you're at work in a private office, when there is no one in close proximity to you, as long as you have a mask available when you're in close contact with others. You don't need a mask when you're alone in a car or accompanied by people who live with you. You should always have a face covering with you when you're not at home in the event that you are not able to socially distance from someone around you. If you have any questions, you can visit stlcorona.com for all of our guidelines on face coverings. At stlcorona.com, you can also follow the data and understand what we're looking at from the public health standpoint, from a data standpoint, as we make these recommendations and try and keep St. Louis County safe. I'm glad to answer any questions. Thank you, Doug. So we did have one question earlier about school openings. Specific guidance will come from the schools on the 20th. In the interim, we continue to meet with pediatricians and superintendents and our public health department to make sure that our guidelines are appropriate. We understand that this is a national conversation. The school guidelines here in St. Louis County will be based on data. They will be based on local conditions, the virus presence in our community. They will be based on recommendations from pediatricians, from our superintendents, and from our public health experts following the data here in St. Louis County. We will also be prepared to change those recommendations should the data change in our community, and we will be prepared to modify or adjust to conditions. Thank you. Good morning. 5 months into this pandemic, we have doctors working diligently to find a vaccine and to learn as much as possible about COVID-19. In our country, in our community, we're used to instant results, fast food, Amazon delivery, or high-speed internet. But there is no really simple solution to COVID-19. Wishful thinking won't go away. It won't make it go away, but responsible actions will. And some of those responsible actions include getting resources to those who need it most in our community. And history is a persistent reminder that many individuals in our community don't have the same resources as others. In fact, in our country, we don't always do a great job of taking care of everyone. We know that our African American community sometimes falls short on many of the measures of life expectancy. For example, in some zip codes in St. Louis County, life expectancy can be as much as 35 years difference. At the bottom of the list is Kinloch, where life expectancy is 56. This is a town of a few hundred people that has been forgotten by many. And for those of you who came this weekend to help clean up Kinloch in an effort organized by State Representative Rachel Prouty, we thank you. We must not allow our communities to be dumping grounds for others. Years of disinvestment in some parts of our region as often goes unnoticed by those who aren't neighbors who don't live close by. As we respond to the COVID-19 pandemic, it shines a bright light on disparities in our community. COVID-19 has had a devastating impact on African Americans in this country and here in this region. Underlying health conditions exacerbated by limited access to health care, limited access to health insurance, or healthy foods all makes fighting COVID-19 very difficult. But when we began this response, I said that we would be directing resources to those who need it most, the most vulnerable in our communities. And that's exactly what we've done. We've made sure that testing and mask distribution was available to everyone. We've granted more than $2.5 million to 5 agencies in our community that are providing food to needy families throughout the region. We've begun sending out checks to small businesses, and we have set aside $19.5 million to support our small businesses who have been hurt by this pandemic. We know that small businesses are where most of our jobs are in the community. And I do want to thank and recognize the county council members who have helped us identify those who need the most help. As I said before, this pandemic is actually 3 crises. It is a public health crisis, a humanitarian crisis, and an economic crisis. And in part of our response to the humanitarian crisis, we actually have a humanitarian response program. And in a week from today, we will announce $9.5 million of grants that will be allocated to support programs in our community and some of the services that help our most vulnerable citizens. And across the country, we have seen COVID-19 test results start to increase. This is in part due to more testing and in part due to more people being out and about. And as we see more positive cases, this reminds us how important contact tracing is. In St. Louis County, we have over 260 individuals who are working in the contact tracing program. And through contact tracing, we were able to identify 12 individuals who were COVID positive who worked at the same manufacturing plant in St. Louis County. And this company in St. Louis County had been working diligently